Set.
Spinal stenosis. Spinal stenosis is a narrowing of the spinal canal, which then puts pressure on the spinal cord. It generally occurs in an elderly population. It can be from bone diseases such as arthritis or Paget's disease, and it can also happen from people with previously injured backs, such as a herniated disc or some other injury that puts pressure on the spinal cord. The relevant anatomy is the lumbar spine and the spinal canal, as well as the spinal cord. For evaluation, you're looking for numbness or tingling in the extremities. Also look for cramping in the extremities as well, especially in the legs. For patients that have spinal stenosis, they can't have pressure on the lumbar spine for long periods of time. For example, they can't walk or stand for long periods of time. Generally, they'll flex their spine forward to alleviate the symptoms or sit down. Lower corticostery, myotones, dermatomes, and deep tendon reflexes will help you diagnose this better. Have the patient stand and walk around for an extended period of time, and hopefully that'll recreate the symptoms. Then if it does, have them flex forward or do what they naturally do to try to alleviate the pain, and study that and see what they actually do to alleviate the pain, and then that could give you further information. If you suspect this, then have them get an MRI or an X-ray so you can clearly see the narrowing of the spinal canal and the pressure on the spinal cord. To manage spinal stenosis, generally you're going to have them do a lot of stretching and exercises that are going to relieve the pressure of the lumbar spine and strengthen the muscles around it. And if they're having flare-ups or severe pain, cold and heat baths can be used to lessen the symptoms. Surgical intervention may be necessary if and only if the athlete isn't responding to the treatment. Doctors would go in and try and surgically release the pressure on the spinal cord, and it's not always guaranteed to have a great relieving effect. That's one disclaimer that goes with it. The take-home message for athletic trainers is you're not going to see this a whole lot in the young athletic population due to the fact that it coincides with osteoarthritis and Paget's disease and other degenerative bone diseases. If you do have a suspected spinal stenosis, get an MRI or an X-ray to confirm, but don't overlook spinal stenosis, especially if they've had a previous back injury. And really, they only need surgery if they're not responding to the treatment whatsoever.